Hello guys, good afternoon. Okay, our topic for today is all about the skeleton. This is our midterm topics on medical glossary. Okay, medyo mahaba-haba ang video, ang PowerPoint na ito, pero tatapusin natin. Okay, so the skeleton, okay, we have the general functions of the skeletal system. For what? For support, for protection, for movement, for storage, and for blood cell production. Okay, for support, the function of the skeleton when supporting the framework of the body. Okay, so kung walang skeleton, hindi mo ma-figure yung buong katawan kung walang buto. Okay, so in short, yung skeleton yung buong buto ng katawan. So support form the framework that supports the body and the cradles of the soft organs, and it also protects. And for protection, it provides a protective case for the brain. Ano pa? Di ba sa brain, meron tayong skull doon. Sa spinal cord, meron tayong spinal column. And the vital organs, what? It supports the lungs. Di ba? Si ribs. Ganon. Okay. And the reproductives, yun din yung may hips. Ganon. The movement, one function is the movement. It provides the levers for muscles. Of course, meron mga joints dyan sa buto na yan, kaya nagkakaroon siya ng, pwede mo siyang ma-move. Okay? Dyan din nakakabit ang ating mga muscle, nakadugtong. Kaya, pag nakikita nyo yung buong katawan natin, aside from bone, meron siyang muscle, kaya meron siyang laman. Okay, storage, it is the reservoir of minerals, especially the calcium and the phosphorus. And of course, blood cell production in the manner of producing the red blood cells sa katawan, sa blood natin. Diyan nangyayari yung hematopoiesis within sa bone marrow cavities ng bones. Okay, next. This is the figure of the bone. So that is the cranium, yung kung saan nakabalot ang ating brain, the facial bones, the mandible, yung dito, and the clavicle. That's what you call the collarbone, the scapula, yung scapula dito sa may likod, or the sa may likod na nakikita nyo parang sinasabi nilang pakpak. That is the scapula. And the humerus, itong nakikita nyo sa may buto sa ating mga braso. Sternum. Dito yung karugtong ng mga ribs, the costal cartilage, the vertebral column, ito. Vertebral column, yung nandito yung spinal cord and the spinal column. The ilium, ayan, nakikita nyo kung saan nakapoint, the pelvis. Okay. Dito rin, that is the ribs. Ayan, nakikita yung ribs. The radius. The ulna. Dalawang buto sa kamay, the radius and the ulna, while the dalawang buto sa legs is the tibia and the fibula. The patella, yun yung pinupukpok ng doktor, tinitest the reflex. The femur, the longest bone, is the femur, okay? Phalanges ang tawag sa bones ng mga daliri. The metacarpals, yung nagdudugtong kay daliri. Okay, the tarsals, kagaya siya ni metacarpals. And the phalanges, yan yung nagdudugtong sa ankles natin, sa mga tarsals. Ganun. Sa calcaneus, ayan, nakikita nyo ang calcaneus, ayan. Yan yung buto dito pag nag-step ka dito sa dulo. Okay, yan, patigas yan na buto. Let's see, sumobra tayo. Okay, next. Okay, the normal structure. First is the acetabulum. It is the bony socket of the hip and hip bone that holds the head of the femur. Okay, acetabulum from the Latin word for vinegar because it resembles the base of the vinegar crochet. Okay, acetabulum. If this is the um, ball and socket. This is the ball and this is the socket. Ito yung acetabulum. Ito. This is the acetabulum. And this is the bone and socket. Okay? Nakakabit yan. Kaya may mga joints dyan. Kaya may joints, may cartilage, ganun. Kaya nagagalaw natin. Okay? That is the acetabulum. Articulation, it is a joint. Lahat articulation, lahat yan. Lahat dito, lahat kung nagagalaw nyo, may mga articulation siya. Meron siyang joints. The atlas, the first vertical vertebra, and the axis, the second cervical vertebra. Oh, so what do you mean by bone? So a bone is a calcified form of dense connective tissues, osseous tissues, also an individual unit of the skeleton made os such as tissue. So pag sinabi mong bone, osteo. Okay? Osteo. Mag-bone. Osseous tissue. Usually, dyan din ang pag nag-inject, pwede rin dyan, osseous tissue. Okay, the bursa. It is a filled sac that reduces friction near a joint. Okay, pag yung joints na yun, that is a fluid. May mga fluid kasi dyan, yung joints, para kaya natin nagagalaw itong mga to natin, it's because nagpapagalaw dyan is the joints. Nagkarugtog yan na buto, pero para maigalaw mo siya, meron siyang fluid. Kasi unable na hindi mo siya magalaw, walang fluid. So, hindi mo siya magagalaw. Okay? So, ang tawag dun sa filled sac na yon is the bursa. Cartilage, ito yung nakikita nyo sa mga manok na malambot siyang buto. Okay? A type of dense connective tissue siya that is found in the skeleton. The larynx, the trachea, and the bronchi. It is precursor to most bone tissue. Ang root niya is chondro. So, pag sinabing chondro, it is the cartilage. Okay? Diarthrosis. The diarthrosis, it is a freely movable joint, also called synovial joint. So, adjective niya, diarrhotic. So, synovial joint, freely siya na gumagalaw. So, ano yung example ng mga synovial joint is yung kusa siyang nagagalaw. Hindi mo kailangan pagalawin pa. Okay, naintindihan? So, diaphysis, it is the shaft of the long bone. So, the long bone, example, this is the long bone. Buto natin dito, long bone. So, yung shaft nun, ang tawag doon, yung shaft nito is the diaphysis. Okay? The epiphyseal plate, it is the growth region of a long bone, kung saan nakadugtong ang long bone, kung saan galing. The epiphyseal plate yon, located in the metaphysis, between the diaphysis and the epiphysis. So, drawing ko na lang siya pag face-to-face tayo para just remind me for this one, para much more maintindihan nyo ang diaphysis and the epiphysis. So, when bone growth ceases, this area appears as the epiphyseal line. It is also spelled the epiphyseal. Okay? Epiphysis, the irregular shaped end of the long bone. So, siya yung ganon. Sa buto kasi, may diretsong ganon, may diretso. Nakakita ka na kayo ng buto ng nasa na usually na nakikita natin into cartoon na buto kinakain ng aso. So, yung naka-shape na ganon, na para siyang heart sa dulo, that is the epiphysis. Okay, the ilium, it is the large flared superior portion of the pelvic bone. Iliac or the ilium, ganun siya. Kung nakaupo tayo, meron siyang flat siya na ganun, no? At mag-base na lang kayo dun sa picture dito sa last. Ayan. That is the ilium. Nakikita nyo dyan. Okay? And then, the joint, it is the junction between two bones. Okay, yung mga nagdudugtong daw dun sa buto na yon. Okay? Arthro, ang joints. Kaya pag may sakit ka ng arthritis, ibig sabihin joint pain na yun. Okay? Inflammation of the joints. or minsan yung fluids doon, konti na lang. So, kaya arthro ang joint, arthritis ang sakit niya. Ligament, it is a strong band of connective tissue that joints the joints one bone together. Yes, hindi mo ma-join ang isang bone kung wala siyang ligament. Para siyang white siya na para siyang fiber na gano'n, na nagdudugtong dun sa dalawang buto. Pag nakakain kayo ng buto ng chicken, makikita nyo yung ligament. The metaphysis, it is the region of a long bone between the diaphysis shaft and the epiphysis end during development. So, the growing region of a long bone. I will draw that later. Okay, the ossification, it is the formation of bone tissue from the Latin os meaning bone. Formation of the bone tissue, ossification. Osteoblast, cell that produce bone tissue. While the osteoclast, it is a cell that what? Destroy the bone tissue. So, pag sinabi mong class, it is bad kasi dinidestroy niya. But when you say it blast, pinoproduce. The osteocyte, this is the site, meaning cell of the bone, okay? A mature bone cell that nourishes and maintains bone tissues. The pelvic, alam nyo na yan, the large ring of bone at the anterior tract. Diyan nakalocate ang so form of two hip bones, the ossa coxae joined to the sacrum and the coccyx, yung dulo. So each os coxae is formed of the three bones, the superior, the flared ilium, the ischium, and the pubis. So tandaan yan it might come out in the midterms exam. Okay, the periosteum. So the fibrous membrane that covers a bone surface, and the fibrous membrane that covers a bone surface, the periosteum. The resorption, it is the removal of bone breakdown and absorption into the circulation. So resorption yun, okay? Nagre-remove siya ng bone breakdown, I'm sorry. Okay, skeleton, it is the body's framework consisting of what? There are 206 bones, okay, skeleton, and 80 bones in the axial portion. It is composed of what? The skull, spinal column, ribs, sternum, and the appendicular skeleton, the 126 bones, contains the bones of the arms, the legs, the shoulder girdle, and the pelvis. So suture, an immovable joint such as bones, between the skull and skull bones. So dito sa sa bone dito sa skull, meron makikita kang parang suture dyan nakaganon. So yung mga suture na yan, suture na yan, para siyang crack pero hindi siya crack. Suture ang tawag kasi doon. Okay? So symphysis, a slightly movable joint, and the synovial fluid, it is the fluid contained in a freely movable, the diarthrotic joint, synovia. Okay, synovial joint. It is a freely movable joint. So magkaiba si fluid sa joint sa synovial joint. Pag sinabi mong synovial joint, a freely movable joint and has a joint cavity containing synovial fluid. Okay? Tendon, a fibrous band of connective tissue that attaches a muscle to a bone. Thorax, the upper part of the trunk between the neck and the abdomen, formed by the what? 12 pairs of ribs and the sternum. Annulus fibrosus, the outer ring-like portion of an intervertebral disc. So, yung mga yan naman, hindi naman makikita mo lang talaga yung mga yan pag talagang hawak na natin ng buto. Okay, clavaria, the dome-like upper portion of the skull. Ibig sabihin, dome, yung pag-ganon. Okay, coxa, andito sa hip. The cruciate ligament, ligaments that cross in the knee joint. Okay, when you say ligament, yung nagdudugtong sa buto. Okay, mayroon siyang thread, siyang ganon, no? Okay, nagko-cross siya, pag cruciate ligament, dito nakalocate siya sa knee joint, okay? Na nagko-connect kay tibia and the fibula. So tibia and fibula, this is the bones in the lower extremities dito sa legs natin, yung nakakapaan yung buto diyan sa diyan sa legs nyo, sa harap. Okay? They are the anterior cruciate ligament and the posterior cruciate ligament. The genu, When you say genu, it is the knee. Okay, tandaan, genu, knee. Glenoid cavity, the bony sacrum in the scapula that articulates with the head of the humerus. And the hallux, it is the great toe. Oh, nasan yung great toe? To, yung pinakamalaki dyan sa toe sa paa nyo, that is what you call the hallux. Okay? Next, the malleolus. The malleolus, it is the projection of the tibia or fibula on either side of the ankle. And meniscus, it is the crescent-shaped disc of cartilage found in the certain joints. So in the knee, the medial meniscus and the lateral meniscus separate the tibia and the femur. Okay. The femur, yung nasa, that is the longest bone, nandito yan sa legs nyo sa taas. But the tibia and the fibula, nandito yan sa legs nyo sa baba. Nakakapaan yung buto dyan sa harap. Okay? So, crescent siya ang shape. So, nucleus pulposus, it is the central mass of an intervertebral disc. The olecranon. Olecranon meaning it is the process of the ulna that forms the elbow. So, nandito si ulna at saka andito si ulna. The process of ulna that forms the elbow. Dito si olecranon. Nandito si elbow. Si olecranon. So, os meaning bone, osseous pertaining to the bone. Symphysis pubis, alam nyo na yan. Okay, dyan yung pelvic joint formed by the union of two pubic bones. Wherein yung symphysis pubis, dyan tayo nagkakaroon ng mga pubic hair. Okay, it is called the pubic symphysis or the symphysis pubis. O bone markings, what are the markings? Condyle, smooth, rounded protuberance of a joint siya. If this is the joint, andito sa gitna, ito yung ball and socket, nandito yung condyle. Okay? Crest, raised narrow ridge. Okay? Epicondyle, the projection above the condyle. If this is the condyle is the above nung condyle. Facet, small flattened surface. Foramen, rounded opening or foramen ovale. Ibig sabihin, foramen, opening siya, rounded. The fossa is the hollow cavity. Usually fossa, nakikita mo siya into, nasa, siya, buto din siya ng brain. Marami siyang fossa dyan. Meatus, this is the passage or channel, such as long channel with a bone, also the external opening of a canal, such as urinary meatus. Yes, makikita mo yan. Kung saan nakalagay yung reproductive, nandun siya, ang meatus. Process, projection, the sinus, of course, dito ang sinus. Andyan yung mga sinus. Si sinus, nandito, air-filled spaces in certain skull bones. Uka siya dito, na may air. Pero pag nalagyan siya ng mga parang sipon-sipon, masakit kasi nga mamamaga siya. Kasi usually air ang nandyan, pero nagkaroon ka ng mga sipon dyan, so magkakaroon ka ng sinusitis. Trochanter, it is a large blunt projection as the top of the femur. And the tubercle, small rounded projection. Tuberosity, the large rounded projection. All of these on face-to-face, much more na i-emphasize pa natin lalo. Okay, region. Meron tayong tinatawag na region, the skull, the trunk, and the bones kung ano yung nandun, and the description. So, sa skull, meron tayong cranium, meron tayong cranial bones. Tandaan na 8 ang cranial bones. So, chamber enclosing the brain, nagbabalot siya sa brain. It houses the ear and forms part of the eye sac. Okay? And facial portion, the facial bones. So, ang daming bones dito. This is 14 bones. Forms the face and chambers, the sensory organs. The hyoid, it is the U-shaped bone under the mandible. Ito yun, no? Nakikita nyo? Nakikita nyo yan? Okay. So, lower jaw, used for muscle attachment. And the ossicles, there are the 3 bones here in the ears that transmit sounds to the middle ear. So, natatagpuan sa ossicles yung pinaka-smallest bone. Okay? or what you call the anvil. Okay, trunk. Vertebral column yung trunk. Kung saan vertebral column, nandyan yung spinal column, spinal cord, ganun. There are 26 vertebrae, okay? It encloses the spinal cord, and the thorax means thoracic dito sa dibdib, sternum ribs, meron siyang 12 pairs. So 12 pairs, hindi 12 ang ribs natin. Meron tayong 24, bali 24 ribs, but 12 pairs ang tawag, the anterior bone of the thorax. Another, the appendicular skeleton. Okay, the upper division, we have the shoulder girdle, the clavicle, and the scapula. Ito yung sinasabi natin na the clavicle or the collarbone. Yung nakikita nyo dyan na buto, hawakan nyo, that is the clavicle. Scapula, na nakikita nyo dito sa likod na pag ginanon nyo ang kamay nyo, makakapa nyo siya. Scapula, that is scapula. That anchors muscle that moves arm. Okay, kaya pag nag-exercise ka ng ganun, gumagalaw ang scapula mo. Okay, upper extremity. Okay, humerus. We have the humerus and the ulna, proximal arm bone. This is the humerus. Guys, this is the humerus. The ulna and the radius nandito. The ulna and the radius. Okay? Carpals, we have the wrist bone. That is the carpals. This is the carpals. Okay? Metacarpals, bones of palms. This is the carpal, this is the carpal, this is the metacarpals, and this is the phalanges. Ito yung phalanges ang tawag natin. This is the phalanges. Okay? So, let's go to the, dito sa, okay, dito muna tayo. Kasi punta mamaya tayo sa lower. Okay, roots for bones and joints. The osteo meaning bone. Osteopenia, deficiency of bone tissue. Myelo, bone marrow, also called the spinal cord. Myeloid, meaning, example ng myeloid, pertaining to or resembling bone marrow. The chondro, ibig sabihin cartilage, chondroblast, example, cartilage forming cell. Arthro, joint arthrosis, or condition affecting a joint like the arthritis. Synovo, or the synovial fluid, it is a joint or membrane. A synovia is the example, it's lack of synovial fluid. Bursor, bursa, perobursal, around bursa. Okay. Okay, we have also these medical terminologies, the skull, the cranium, craniometry, measurement of cranium, spondylo, meaning vertebra and spondylo, or the spondyloid, sinasabi nila. The spondylolysis. It is, when you say lysis, laging lysis is the breakdown or the destruction and separation of vertebra. Ibig sabihin ng lysis, it is a breakdown or the destruction. Vertebra, spinal column, paravertebral, near the vertebra or spinal column. Rachis or spine or rachio, rachiasis or the fissure of the spina bifida, it is a disease. Costo or the rib, costochondral, pertaining to a rib and its cartilage. The sarc or the sacrum, presacral, in front of the sacrum. The coccygeal, pertaining to the coccyx, yung pinakadulo sa buto sa puwit. Pelviscope, endoscope for examining the pelvis. Iliopelvic, pertaining to the ilium and pelvis. Okay? Okay. Another medical terminologies, the ankylosing spondylitis. When you say itis, inflammation, okay? So it is a chronic progressive inflammatory disease involving what? The spinal joints. Okay? Ankylosing spondylitis, spinal joint siya, inflammation. And surrounding soft tissue, most common in young males, o kagaya nyo. Also, what you call the rheumatoid spondylitis. Usually, pag sinasabi nilang rheumatoid spondylitis, nahihirapan silang maupo. Kasi inflamed yung sa likod nila. Usually, gusto nila nakahiga lang. Ankylosing, it is the immobility and fixation of a joint. So, hindi mo siya magagalaw. Arthritis, it is the inflammation of a joint. The chondrosarcoma, a malignant tumor of what? In the cartilage, tumor sa cartilage. Curvature of the spine, an exaggerated spinal curve such as scoliosis, lordosis, and kyphosis. So, curvature of the spine. So, yan, kung meron kang scoliosis sa likod, nakalaging naka-slouch, that is scoliosis, lordosis, and the kyphosis. Okay, degenerative joint disease, ito yung osteoarthritis. Yan yung sakit ng mga matatanda, osteoarthritis. It is a degenerative joint disease. The fracture. Okay, fracture is a break in the bone. Okay, pag na-aksidente ka, may fracture. Nalaglag ka, may fracture. Okay? In a closed simple fracture, the broken bone does not penetrate the skin. Ibig sabihin, pag closed simple fracture, nabali ang buto mo, pero hindi nagbukas ang skin mo. Doon lang yung bali sa loob. Wala kang sugat sa skin. But in an open fracture, there is an accompanying wound skin. Pag open fracture, ibig sabihin na open yung buto mo, na bali ang buto mo, lumabas siya sa skin, nag-breakthrough sa skin. That is open fracture. Okay, gout, ibig sabihin, arthritis, it is a caused by arthritis. So, nagkakaroon tayo ng deposit of uric acid sa mga joints, kaya nagkakaroon ng gouty arthritis. Herniated disc, ibig sabihin pag herniated, lumabas. Dito sa disc, kumbaga may disc na ganyan, nag-herniate, lumabas. Yung ibang, nag-protrude ang mga, dun sa disc, may mga nag-protrude. So, that is herniated disc. Protrusion of the center, okay, of an intervertebral disc into the spinal canal, or the rupture, or what do you call slip disc. This is a very, very difficult to have a disease like this, itong slip disc. Ang hirap gumalaw. Kasi, meron kang herniated disc na lahat kontrolado ang paggalaw mo na hindi mo dapat kayang gumalaw na sobra-sobra. At saka controlled lang. Masakit yan, sobra, pag slip disc. At pag nabigla ka pa, sobrang sakit. Okay, the kyphosis, it is a exaggeration. Ito yung kyphosis, ito yung curvature of the spine, okay? So, kyphosis, this is kasama ito ng scoliosis. The kyphosis, it is an exaggerated curvature of the spine in the thoracic region, sway back, or tinatawag ng sway back. So, kyphosis, dito siya. Pag ganun siya, sobra siyang press out. Lordosis, an exaggerated curvature of the spine in the lumbar regions or the humpback. Yun yung, nakita nyo na yung hump, nagkaroon na, yung may hambang, sobrang scoliosis niya, sobrang curve ang niya, halos nakaganon na lola. So, ayun yun. Okay, osteoarthritis, it is a degenerative disease, tandaan yan. Osteogenic sarcoma, when you say sarcoma, it is a malignant bone tumor. The osteomalacia, when you say Malaysia, of course, softening or the weakening of the bones due to what? Vitamin D and the calcium. Okay? Deficiency. Osteomyelitis, inflammation of the bone and bone marrow caused by infection. Usually, bacteria yan ang pupunta kay buto, which is masama. Osteopenia, okay, mababa ang kanyang, inya, meaning sa blood, okay? A lower than average bone density and which may foreshadow osteoporosis. Mababa ang kanyang mga content na vitamins and minerals dun sa puto niya. Osteoporosis, it is a condition characterized by reduction in bone density. Nakakita na kayo ng mga osteoporosis, nakikita nyo na yan, yung mga kulang sa gatas-gatas. Okay, usually nag-o-occur yan, it is because of menopause, pag hindi na nag-mess, dahil sa mababa ang kanilang estrogen level. Okay, next, we have the Paget disease. When you say Paget disease, it is a skeletal disease of the elderly adult, ibig sabihin. So, characterized by bone thickening and distortion with bowing of long bones, ostitis deformans. Ang ibang tawag kay Paget disease. Minsan, mostly sa abroad na meron yan, Paget disease. Pat's disease, ito yung tinatawag na TB of the bones. Nagkakaroon ng TB, tuberculosis sa buto. Nag-inflame ang iyong mga invertebrate. Ito yung Pat's disease or the tuberculosis. matetest mo lang siya by lumbar tap. Okay? Pag positive siya sa lumbar tap, ibig sabihin may Pats disease or tuberculosis sa likod. Usually mga taong ganyan, nakahiga lang, hindi sila nakakaupo, hindi pa sila nakakalakad. Rheumatoid arthritis, chronic autoimmune disease, rheumatoid arthritis, unknown origin, but under siya sa autoimmune disease. Okay? Usually mga rheumatoid arthritis, yung nakikita nyo disease trait, sa kanila ganun siya. Parang nagsaswan. Gaganon ng mga daliri nila. Ganyan. Yan. Ganun. Ganyan ng mga rheumatoid arthritis. Rheumatoid factor, a group of antibodies found in the blood in case of rheumatoid arthritis and other systemic disease. The rickets in young, usually rickets in young tawag, kulang sila sa vitamin D. Okay, faulty bone formation in children, deficiency of what? Vitamin D. Because they don't eat, a lack of vitamin D intake leads to rickets. Sciatica, severe pain in the leg along the course of the sciatic nerve. Kaya nga sciatica, kasi nandun karugtong niya sa sciatic nerve. So usually related to spinal nerve root irritation. The scoliosis, ito yung sinasabi ko sa inyo, yung curve ang buto, ang likod mo. Mandami sa inyo ang scoliosis minsan nakikita ko. Spondylolithasis, the forward displacement of one vertebra over another. Lithasis means as spinning, so nagpo-forward ka ng ganyan. Spondylolysis, breakdown of pores, degeneration of the articulating portions of the vertebra, allowing for spinal distortion, specifically in the lumbar region. Okay. Another medical terminologies, the symptoms and the conditions. Under the symptoms and conditions, the achondroplasia, decreased growth of cartilage in the growth plate of the long bones resulting in what? Dwarfism. So this is a genetic disorder when hindi tumatanggap din ng isang tao. It is because of achondroplasia. Baker's cyst or this Baker's cyst, it is a mass formed at the knee. Okay? Distension of the bursa. Pag inflamed yung bursa, ang tawag dyan ay bursitis. With excess synovial fluid resulting from chronic irritation. Bunion, it is an inflammation of an enlargement of the metatarsal joint. Metatarsal joint, kung ito ay carpal, this is metacarpals. Dito sa paa naman, yung ganito natin sa paa, kung di ba ito yung toes natin, ito ang tinatawag na metatarsal. Okay? Okay, bursitis, ito yung sinasabi ko, inflammation of the bursa. Saan yung bursa? Sa knee. Okay? Causes include injury, irritation, and joint disease. The shoulder, hip, elbow, and knee are common sites. The carpal tunnel syndrome, okay, mahirap din itong carpal tunnel syndrome. It is the numbness and what? Weakness of the hand. Nagna-numb ito. Tsaka parang weakness. Hindi siya gaano madala. Caused by pressure on the median nerve as it passed through a tunnel formed by carpal bones dito. Kasi median nerve, so minsan hindi siya nakakagalaw pag napapress siya. Chondroma, a benign tumor of cartilage, and Ewing tumor, a bone tumor that usually appears in children 5 to 15 years of age. It begins in the shaft of a long bone and spread readily to other bones. So Ewing tumor, nag-umpisa muna yan sa mahabang buto, then nag-spread throughout. Okay? Also called the Ewing sarcoma. Okay. Another, the exostosis. Exostosis is the bony outgrowth from the surface of the bone. So the giant cell tumor, a bone tumor that usually occurs in children and young adults. And the bones are destroyed commonly at the knee by a large mass that does not metastasize. So, yung mga common giant cell tumor naman dito sa niyan. Meron akong friend na nandyan. Tinutol na lang ang paa kasi natakot silang mag-metastasize. But according naman, so hindi naman daw gaano. Pero mahirap na din magtiwala. Okay, the hammer toe. Change in position of the toe joint so that the toe takes on a claw-like appearance and the first joint protrudes upward, causing irritation and pain on walking. Masakit yan. Nakaganon ang toes mo. Hallux valgus. Hallux, pag sinabing hallux, dito yung kung saan kayo ito yung pinakamatigas sa lahat ng buto na kaya niyang hawakan ng buong katawan. Okay? Yan yung nandito sa malapit sa ankle, pinakababa ng sole natin sa dulo. Yon. So, painful conditions pag ang hallux valgus, pag nagkaroon ng lateral displacement dyan, masakit. Heberden nodes, it is a small hard nodules formed in the cartilage of the distal finger joint on osteoarthritis. So, usually in osteoarthritis, dun mo makikita pag osteoarthritis, for example, dito sa mga joints dito, meron kang makikita Heberden nodes. Okay? Hemarthrosis, it is the bleeding into a joint cavity. The leg calf pertis disease, degeneration or osteochondrosis of the femur's proximal growth center. The bone is eventually restored, but there may be deformity and weakness, also called the coxaplana, ang leg calf pertis disease. The multiple myeloma, cancer siya, myeloma, blood-forming cells in what? In the bone marrow. Karaniwan may mga sakit na nagkakaroon ng ganyan. Ang hirap. Kasi, syempre, weakness, gano'n, hindi ka naapektuhan din yung everyday na paggalaw mo. Okay? Next, the neurogenic arthropathy or degenerative joint disease caused by impaired nervous stimulation. Most cause in diabetes mellitus, ang neurogenic arthropathy. Okay? The Osgood-Schlatter's disease, degeneration or osteochondrosis of the tibia's proximal growth center. Asan yung tibia and the fibula? Dito, buto yan. Dito sa leg sa baba. Causing pain and tendinitis of the knee. Masakit siya yan. Sobra. Osteochondroma, a benign tumor causing of cartilage and bone. And the osteochondrosis, the disease of bones growth center in children. Tissue degeneration is followed by what? Recalcification. Osteodystrophy, abnormal bone development. Osteogenesis imperfect, the hereditary disease resulting in the formation of brittle bones that fractures easily. And there is faulty synthesis of collagen, the main structural protein in connective tissues. The osteoma, a benign bone tumor that usually remains small and localizes. Okay, Reiter syndrome, chronic polyarthritis that usually affects young men, mga kagaya nyo, na nagkakaroon ng bacterial infection in those infected sa HIV because it involves the eyes and the genitourinary tract at nagkakalat na yan sa bone. That is the Reiter syndrome. Next, okay, the spondylosis. It is the degeneration and ankylosis of the vertebra sa likod, spondylo. Okay, alam niyo na yung kung spondylo, sa likod lagi. Subluxation, a partial dislocation. So, pag itong buto, nadidislocate siya, ibig sabihin, yung dito, wala siya dito, napunta dito. Yung buto mo dito. So, partial lang. Talipes, the talipes is deformity siya ng foot, paa. Especially occurring, congenital siya, ang talipes. Hindi siya nangyayari but it is congenital or tinatawag nating club foot. Ganito siya. Gaganon. Imbis, ito yung mga toes mo sa sa paa. Nagaganon siya. Lahat. Club foot. Wala kang makikita. Nagde-deform ang mga toes niya. Wala kang makikita na toes. The valgus, it is the bent outward. Outward siya. And bent in, pag nag-bend ka daw, outward, that is valgus. Varus, bent inward. And the bone, Recklinghausen disease, it is a loss of bone tissue caused by increased parathyroid hormone. Bones become decalcified and decalcified ang buto, nade-deform. So that is what you call the disease of bone, Recklinghausen disease. Nade-decalcify ang buto into what? Cause increase ang parathyroid hormone. Okay, that's the last. Okay. And the skeleton, ito, types of fracture. Ito yung sinasabi ko sa inyo. This is the normal. Transverse, of course, ayan. The oblique, ayan. Tandaan itong mga to, oblique, diagonal siya. Spiral, ibig sabihin, pabilog siyang ganon. Communicated, ayan, bali-bali ang kanyang buto. Wait lang. Okay, guys. Bali-bali ang kanyang buto. Ayan, nakikita nyo? Paano na kayo idudugtong yan, no? Bali-bali. Avulsion, ayan. Avulsion meaning yan, nagka-hiwalay silang dalawa. Impacted, ayan. Impacted meaning ano siya, na-fracture siya na masyado siyang bugbog. Fissure, ayan. Ito yung fissure. Sinasabi ko sa yung para siyang fiber na, ayan, no. Green stick. Green stick, ayan lang siya. Minsan itong green stick, ayan siya. Na-fracture siya sa pinakauna lang, pero hindi siya totally fracture. Okay? Okay, we have the types of fracture. The closed, a simple fracture with no open. Calls a fracture of distal end of the radius with backward displacement of the hand. Comminuted, ito yung nakita nyo kanina, fracture in the bones, in which the bone is splintered or crushed. Compression, fracture caused by force from both ends as the vertebra, nako-compress. Green stick, one side lang siya ng bone, hindi siya totally broken. Impacted, one fragment is driven to the other. Oblique, break occurs at the angle across the bone, usually one fragment slips by the other. Open, it is the fracture is associated with open wound or broken bones protrudes through the skin. And the paths, yun yung fracture, distal end of the fibula with injury to the tibial joint. The spiral, it is also a fracture in a spinal or a spiral S-shape siya ng fracture. Tinatawag din siyang twisting injuries. Transverse, of course, pag ganun lang siya. Break at right angles to the long axis of the bone. Okay, medical terminologies related to skeletal system. We have this, the allograft. Wait lang. Okay, allograft. The graft of tissue between individuals of the same species but different genetic makeup. Meron siyang homograft or the allogenic graft. Okay, arthroplasia, surgical breaking of ankylosed joint to provide movement. Nagbe-break siya. So aspiration, removal by suction. So ina-aspirate mo yung fluid from body cavity. Tinatanggal from body cavity ang fluid. That is aspiration. The autograft, graft of tissue taken from one side into the body of person receiving the graft. And the chondroitin, a complex polysaccharides found in connective tissue, uses a joint dietary supplement, the glucosamine siya, and the treatment of joint pain. Okay. Glucosamine, so dietary supplement siya na ginagamit sa pag-treat ng joint pain. And the goniometer, device used para i-measure yung joint angle and the movement. The iontophoresis, it is the introduction into the tissue by means of electric current using the ions of a given drug used in the treatment of musculoskeletal disease. And laminectomy, ito yung removal of the posterior arc of the lamina of the vertebra. Okay, laminectomy. Okay. The meniscectomy, removal naman siya ng crescent-shaped cartilage or the meniscus. Tinatanggal ang meniscus. The removal of the meniscus of the knee joint. Okay? Meniscectomy. The myelogram, it is the radiograph of the spinal canal after injection of what? Radiopate. Ang myelogram, basta magkita kayong gram ng ganyan. Merong radiopate na ini-inject muna. Dye. Merong mga nursing precautions na ginagawa, but hindi naman na natin cover yun. But that one, para ma-visualize yung loob. Okay, used to evaluate what? Herniated disc. Ano tinatawag natin herniated disc? That is the slip disc. Okay, osteoplasty, it is the scraping and removal of damaged bone from a joint. Basta plasty, okay? Prosthesis, yan yung ginagamit ng temporary or artificial na part ng buto. Okay, pag tinanggal ang isang paa mo, nilagyan ni kanila ng prosthesis para makalakad ka na parang feeling mo buo pa rin ang katawan. Okay, other treatment, alkaline phosphatase, an enzyme needed in the formation of bone. The arthrocentesis, okay, of course, aspiration of fluid by joint, by needle puncture. And arthrodesis, surgical immobilization, nagkakaroon ng fusion sa joints. Pag arthrodesis. Arthroplasty, of course, plasty, replacement of the joint with a prosthesis. Arthroscopy, visualization, or using the endoscope to examine the joints or the interior of the joint na nagpe-perform ka ng surgery. Discectomy is the surgical removal of what? Tinatanggal mo yung herniated intervertebral disc, also spelled that dissectomy. Okay? Herniated intervertebral disc, ito yung tinatawag natin na slip disc. Orthopedics, the study of treatment of disorders of the skeleton, muscle, and associated structures. Ortho, okay? Orthopedics. So, pag nagpa-check up ka sa buto, punta ka sa orthopedics. Okay. The reduction of the fracture, return of a fractured bone to normal position, may be closed, not requiring surgery, but open requiring surgery. Okay, traction. Pag sinabi yung traction, nagkakaroon ng pulling. So, pag may bali ka at may nangyari sa'yo sa injury mo, ang ginagawa usually, nagkakaroon ng traction, nilalagyan yan ng LED na traction na ganyan, triangle, or depende sa weight, lalagyan, isasabit yan sa bed, tataas yung paa mo, then parang hihilain niya, magkakaroon siya ng pulling. Okay? Okay, that's all for today. Next meeting, we will continue the topic. Okay, thank you guys. And please study this one. After nitong mga to, magkakaroon tayo ng quiz na naman because we have only 2 meetings left before the midterms. Okay? Thank you and God bless everyone. Bye.